PCOS is a complicated health problem that is widely misunderstood. I have so many patients who have been fed misinformation about PCOS from things that they have read or seen online. In today's video, we are going to go over 10 myths that I have commonly heard. Hi everyone, my name is Dr. Basma Faris. I'm a board-certified OB-GYN who specializes in treating women with PCOS. Myth number 1 is that PCOS automatically makes you overweight. The fact is that not everyone with PCOS gains weight. Some women stay at a normal weight, but still they may have to deal with hormone and fertility issues. Myth number 2 of 10 is that people think that losing weight with PCOS is impossible. The truth is that losing weight with PCOS can be harder, but it is absolutely possible with the right guidance and tools. It is important for people with PCOS to know that even a 5 or 10% weight loss can improve insulin resistance, hormones, and menstrual cycles. So what makes most diets fail in PCOS and what works instead? Crash diets don't address insulin resistance. What actually works is steady blood sugar control. And later in the video, we'll get into exactly how to get steady blood sugar control. Myth number 3 is that some patients believe that just changing their diet will cure PCOS. Unfortunately, there is no cure for PCOS, but you can manage the symptoms with lifestyle, and that can include diet changes. This means eating a balanced, blood sugar-friendly diet can make a big difference in symptoms and weight control. Myth number 4 is that exercise doesn't matter if you have PCOS. The truth is that exercise is one of the best tools you have as a patient with PCOS. It is important to focus on both strength training and cardio because both of these can improve insulin sensitivity and help with weight management and energy levels. Exercise can also help with steady blood sugar control, especially if you choose physical activity like walking after a meal. Myth number 5 is about lean PCOS. People believe that if you are thin with PCOS, then the PCOS will not affect your metabolism. The fact is that lean women with PCOS can still have insulin resistance, high androgens, and increased risk of diabetes. PCOS is not just about weight. Myth number 6 is PCOS patients telling me that they are absolutely not allowed to eat carbs. This is not true. You do not need to cut out carbs in PCOS, but you do need to pick the right ones. Choose whole grains, fruits, and veggies because they are way better than sugary or refined carbs. Remember when I told you about steady blood sugar control? Well, picking the right carbs can really help with that. Myth number 7 is that using birth control pills will cause major weight gain in patients with PCOS. The fact is that most women do not gain significant weight on the birth control pill. Some may see slight changes, but birth control often helps regulate periods and reduce symptoms of PCOS. Myth number 8 is that supplements are absolutely necessary to treat PCOS. The fact is that supplements like inositol or vitamin D can help, but they're not magic. They work best alongside healthy habits like diet and exercise. Myth number 9 is that PCOS weight gain is just about eating too much. The truth is that for PCOS patients, weight gain is not only about how many calories you eat. Hormonal imbalances and insulin resistance make your body more likely to store fat, especially around your midsection. So it is harder for PCOS patients to lose weight if they are not choosing the right foods. Finally, one of the most common myths about PCOS is that once you lose weight, patients think that their PCOS goes away. The truth is that weight loss helps PCOS, but it is a chronic condition that does not disappear. This means that it is lifelong and it needs ongoing care even at a healthy weight. What questions do you have about PCOS? Leave them in the comments and I'll do my best to answer them in a future video. I hope you found this helpful, and remember to hit like and subscribe below, and I'll see you in the next video.